Hi everyone, my name is Elle.
And I am CJ. And we are part of the RISE team here at Manchester Met. We've been working closely with our different colleagues across the university and externally with a collaborative team who have put together this design thinking course and workbook for you. We've worked really closely with your departments to come up with problem briefs for you to go through this week, and we're really hoping that you'll join us in considering problem solving as a really important skill for life.
Yeah, definitely. Everything from navigating daily challenges to solving complex problems, or actually even conducting things like a research question. They all fall under problems for me. We solve problems all the time and are most likely doing it without even thinking. But what happens when we have a really big problem to think about, to navigate, and to begin to solve? How do we unpick that problem and begin solving it? Well, that's what we're here to discover. So here goes.
Absolutely. We're really excited that you're joining us on this premiere showing of this YouTube broadcast that's going to be accompanying your design thinking workbook, which you can find on our RISE website.
Yeah, definitely. Remember, during the live broadcasts, that you can start to use the comment section on YouTube, and we really want you to get involved with sharing your ideas with the team by uploading and sharing your work that you're working on, everything like so far that you've got to do that day. We can actually see what you've been doing and start to have a conversation with you about it. Remember though, this is a point in time. It's not about polished work. It's an iterative process and just a point in the method that we want to see.
Absolutely. So please do continue to share your thoughts and ideas and join in the conversation on this. If you're watching at a later date, make sure that you read through the chat and see what's been discussed and what's been shared with other people's thoughts and opinions and questions are. They may bring up something that you've never thought of, or you may find that you've got a lot in common with others and their ideas.
Yeah, definitely. That's really useful. We hope that you're getting loads out of the accompanying workbook for your course. It's so exciting to be broadcasting live and sharing all these amazing, what all these amazing people have been doing, who we've interviewed and who we've collaborated with to produce the course. Right. So really quickly, we're just going to hear from Shelley. Shelley McNulty is Head of Design here at Manchester Met, and she would really like just to welcome you to the course.
Hi everyone, my name is Shelley McNulty and I'm the Head of Department for Design here at Manchester Met. So, what is design thinking? Design thinking is a creative problem-solving approach which enables participants to come up with innovative solutions to everyday challenges. Anything from engaging services for our ageing population, to the impact of technology on society, to creating jobs for prisoners. Why are we running this here at Manchester Met? Well, design thinking is being more widely used, not just by designers, but many businesses and public sector organisations, such as banking, local government and the NHS, to address challenges within their organisation, either in their service delivery or to innovate new ways of engaging with their users to produce better solutions for everyone. And we thought, well, if this is happening in the professions many of you will graduate into, then why not introduce as part of Future Me Week? So you understand the value of this approach from the get-go, and it's something that will be desirable on your CV. Having said that, design thinking isn't yet commonplace in other professions, so it's a way of introducing the approach to those who might not have encountered its benefits before. So why should students take part? Well, as well as learning a new technique which might help you innovate in your discipline, design thinking enables and engages with all 10 future job skills cited by the World Economic Forum's Future of Jobs report, specifically analytical thinking and innovation, complex problem solving, critical thinking and analysis, creativity, originality and initiative, reasoning, problem solving and ideation. So if you're thinking, I'm not a creative and this is not for me, think again. It might just get you your future job. So what advice would I give to students taking part in this design thinking course? Well, you really just need to get stuck in. Put aside any preconceptions you might have about thinking creatively. This is nothing to do if you were good at art at school, but more about how you think, how you collaborate, how you think sideways and look at the world differently. But most of all, have fun and trust the process. Most importantly, it's fantastic to be working with you all. You're already design thinkers, you just don't know it yet.
Thanks, Shelley.
Before we take a look into the workbooks and some of the key concepts that you've been looking at today, we're going to hand it over to Jonathan Ball. With a background in product design, Jonathan's built his career using the practice of human-centered design to help organisations innovate and make change.
And Jonathan was actually part of the original team who created the double diamond. You're going to hear from Jonathan throughout the week because of his extensive understanding of design thinking, but we're going to let him introduce himself because he does it best.
I'm Jonathan. I'm a designer, and I'm part of the team that in 2003 at Design Council created the double diamond. And I'm going to sketch it out and just show you how I think it works. One of the things I realised when I started to try to wrap it into my work is that if I just introduced the double diamond in its finished form, maybe I didn't bring people with me as easily as I might. So I'm going to share with you the way that I always introduce the double diamond today. I think for many people it's the way that's been adopted by many people. So this is where I'll start. Generally, you get somebody come to you, some lovely person comes to you, and they'll come to you with a brief, a requirement spec, something that's instructing you to get on with the job. So you'll get this document, a brief, and what generally happens, and I see this everywhere I go today, it's still the way it is with many organisations, many individuals, many businesses, is that people will go in a straight line. They'll take the brief, they won't question it, and they'll go through sort of a paint by numbers approach, and they'll go, having taken the brief, they'll go to deliver something through a series of steps, milestones if you like, stage gates, and they'll go from sort of gate to gate, they'll go for approval, they might get knocked back for some reason, it's going over budget, there's something faulty in what's being done, it doesn't maybe engage with the user enough, they'll go again, a couple more gates, they might get knocked back again. But then what comes out at the end is that there'll be something that comes out as a finished thing that will be great. It'll have answered the brief, but maybe it isn't quite as good as it might have been if we'd taken a slightly different approach, a more enhanced approach. So this leads me to a diamond. So if you flare and focus around the steps that you're going through with good project management, you're probably going to do a better job. If you expand your thinking and sort of diverge and then converge, you're probably going to get a better outcome at the end. And that gives us our first diamond. And these little stars that I'm drawing might represent the research that you're doing. You're never going to stop doing research right the way through the process. These silly little arrows are suggesting that there'll be these iterative loops, this make, test, learn that you're doing all the way through the process where you're trying things out as early as you can to learn from them. So that what comes out at the end, if we had like a one-star project or product or service came out, then this might actually give us a two-star project, something that's that little bit better than it could have been if we hadn't done our flare and focus. However, when we were looking at the work that we were doing with clients at Design Council at the time, we analysed it, we found that the very best projects were the ones when people said, actually, are we trying to solve the right problem? Are we trying to solve the right challenge? And what we found was that actually there was a first diamond. It had all the same attributes as the second one, with research all the way through, probably testing and learning right the way through. But the whole point of this first diamond is to make sure that we're actually trying to solve the right problem, the right challenge. And when I build the double diamond backwards like I've just done now, what I find is that audiences I'm talking to, the teams I'm working with, start to nod their heads and think, yeah, actually, what we generally do, we take the brief and we go in a straight line. We might do a bit of experimentation, but we're usually thinking we could have done more, we could have thought more broadly, and maybe we should have been a little bit more robust in either questioning the people that brought the brief to us or just taking permission and just introducing this first diamond. It's got 4 steps to it. So this half of the first diamond is discover. Second half of the first diamond is define. So that's giving us the brief, the clarity on the challenge or the problem. The first half of the second diamond is develop. And the second half of the second diamond is deliver. If I was going to name the diamonds themselves, then I'd say this first diamond is about problem framing. And the second diamond is about problem solved. And maybe unlike lots of people that use the double diamond, I see it as the complete process. So this isn't about me as a designer taking it all the way through and handing it over to somebody else. This is all the way through to the product or the service being put into somebody's hands.
Thanks, Jonathan, for talking us through the double diamond. Please remember, let us know how you've been getting on with the double diamond approach in the comments below this video.
So, you've been starting your discovery process, the first element of the double diamond. You should have had a chance to think about the assumptions that you might be bringing with you into this process and your challenges.
Yeah, so next we'll listen to an interview with Sarah Moriarty. Sarah is a senior lecturer at Manchester Met in the Department of Design, and she's going to talk to us about assumptions. The function of assumptions, their use, both positive and negative, and the effect that they have on design thinking.
Yes, hello, my name is Sarah Moriarty and I'm a senior lecturer on the product design programme. So my advice to you would be to choose projects that do take you out of your point of reference. I have very much said to our students and say to our students, you're never designing for yourself, because if you were designing for yourself in that demographic, nobody else is like you. But a good way of starting is almost choosing a target market or choosing a demographic that just isn't you. So it's understanding the network. If you haven't got the network, then don't do it. If you haven't got the network but you really want to do it, then a lot of your prep work will be about reaching out to people within the university is a great place to start, and asking people who they know, what they know, how to bring them on board. Because if you haven't got the people in front of you, that your bias and your internal mechanism will always respond back to what you know, and you're trying to break out of that at all times. Well, if you look at design thinking as a model, the first step of that is empathy. So it's really important that it's not assuming that you can be empathetic or empathic. It's understanding the tools of what you have to be like when you're with people that you don't know. And I would say that what I would say to my students is that notion of being humble. And you've got to be open to finding out new things. So what I would always do in that sort of situation is say to students, you approach people with value on them. They are adding value to your project. They know more about their lives than you do. So you've got to be extremely non-judgmental and ask very obvious questions, because you have to get people on side. And if you go in there with any sort of edge, and oftentimes they're giving their time up for free and they're volunteering. So that empathy has to come with that. You give them a value, you're giving them worth. And that is a key aspect of how we engage and keep people in our projects, because and also we're designing with them and not for them. So you're getting them right at the start of a project. You're not saying at the end, I think I'll email an older person or an old person, as my students have learned not to say, and we'll design this for you. And they're like, really? So we're saying we've got this problem and we need to understand how you are doing this in your life, and then we're going to design with you. And that goes a long way for the empathy.
Thanks, Sarah, for that great insight. Really interesting, especially when we're thinking about other people, even people who are different in age, in community, have different experiences than ourselves, and how that might affect our thinking in this process.
Next, we're going to introduce you to another of our colleagues. This is Jaina, and he's here to talk to you about getting the most out of your research.
Hi, I'm Dr. Jaina, and I am a subject lead for a Master's in Design Innovation and also a senior lecturer at Manchester School of Art. So let's talk about why research is important in design thinking. We question a lot of things throughout our lives. From a young age, the world is full of things that we don't understand. We ask questions to parents, guardians, and teachers, and also seek answers from books and, more often nowadays, online resources. This exploratory human nature is the key to any research and our endeavor to find the best answers from the available resources. You have identified a topic that is of academic or personal interest. It may be a broad topic that you don't know much about, or you might have keen interest in that topic already and actively seek to find an answer. You will know about the topic by passive scanning, the collection of information gathered from our encounter with the topic by looking at the news, reading articles online or offline. Or you might have actively scanned the issue by searching for more specific information about it. So with that in your background, you can really delve down to identify a problem you want to solve. Ask yourself why that is a problem, and then ask why again and again 5 times. It could be annoying to answer the why questions when someone is asking the why question repeatedly, but this 5 why tool is a great way to drilling down the fundamental issues behind the problem. Regardless of your discipline area, you would have done some form of research, whether it is secondary research from books, journals, or web sources, or primary research such as interviews, workshops, and questionnaires. Searching for the latest happenings for the chosen topic, as well as identifying the social, technological, economic, environmental, political, legal, and ethical trends, also known as steeple or pastel analysis, will help you get a better sense of the context and issues that surrounds the topic. At the same time, it will broaden your perspective on some of the external factors that influence the very nature of the problem. Also, to make the most of your research, you need to identify what is valuable and reliable information to expand your knowledge of the topic. Ask yourself the question, where does the information come from? Is there any bias in the data? It's like doing a detective work to identify the right information, to find the key information that will inform or inspire your idea generation. In his book, The Science of Design, Herbert Simon mentions that everyone designs who devises courses of action aimed at changing existing situations into preferred ones. Asking why you are interested in the topic and understanding the current situation through research will be a great first step to creatively solving the problem you have identified, making the current situation into preferred one.
Thank you, Jay.
So, to produce this course, we have been getting out into the wild to hear ways design thinking is used outside of education. We will be dipping into these through the week. First up, we have Paul Neely, who will be sharing his experiences, why he finds research important, and how assumptions affect the process, especially when looking at the part empathy has in design thinking. So we hope you find his insights as helpful and encouraging as we did.
Hi, everyone. My name is Paul Neely, and I'm an American designer and researcher based in London. My expertise is in service design and speculative design, the design of future products and services, and I do a lot of work in design thinking. I teach at the Royal College of Art and also at the School of Critical Design, and I also run my own design studio, Neely Worldwide. And in that work, I get to work with a lot of really interesting clients, from Google X to Microsoft to Zaha Hadid Architects to John Lewis and the NHS. And one of the areas I love working is in healthcare. And we often joke in healthcare, the system is so complex and there are so many kind of broken parts that almost anything we touch is an opportunity to create new value, to fix things and to make improvements. And I love working in healthcare because the work feels really meaningful. We get to help people. We get to help doctors and nurses who have dedicated their lives to helping others. And by fixing those systems and those processes and those experiences, it's exciting for me to feel like we're able to deliver better care. I've worked on some really interesting projects with with different healthcare groups. I worked on the world's first virtual hospital about 10 years ago in the United States with Mercy Hospital, and they built a beautiful building, 300 doctors and nurses, and no patients. All the care provided remotely to the little hospitals, smaller regional hospitals, or patients at home. And I've also worked with the NHS most recently on work following out from COVID on how we take care of the many people who are waiting for elective procedures and the long wait lists there, and how do we improve their time spent before those procedures and make that worthwhile. So design thinking for me is quite exciting because it helps. It's ultimately a decision-making process that improves the way we go about making choices in the world. And the first part of this is always the research process. And I love this, particularly on complex problems like transforming healthcare systems. We get to observe, we get to talk with people and interview them. We get to spend time in those spaces understanding exactly what's going on. And that research process is exciting because it often throws out or breaks down many of the assumptions we have about how the world works. And I particularly like this when I'm working with say, a world-class surgeon who spent 30 years working in a space on a particular surgical setting, trying to understand the best way to deliver care. And we can together use the design thinking process for them to see things in a new light and realize that some of the assumptions they had can maybe be thrown out, and that leads to the new opportunities to make improvements and find innovations in that space. So those assumptions break down. Another part of design thinking is that it builds empathy. And when we actually get to observe people, patients experiencing some of these difficulties, when I see nurses or others, struggling with a system or are running into problems with some of the places they're working in, by observing, by understanding how others are feeling, that feeling of empathy creates an understanding that helps us make better solutions and better choices about what will fix those problems. But it also generates a lot of motivation within the system when leaders and decision makers can feel that empathy and understand the real problems that people are facing. They are motivated to make changes and make adjustments in the system. So I love those things about design thinking and how it can change the ways that we operate, breaking down those assumptions, building empathy. But also, I think this decision-making process is really well suited to our own lives. And I've even experimented with design thinking in the design of my life and designing it for happiness. And I realized, so much of our lives are actually haphazard. They're evolved. They're not considered. We haven't looked at them. They're built on these assumptions. And by using design thinking, we can begin to understand, well, what's really going on? What's really driving, say, happiness? And can we redesign our nutrition and our health and our exercise and our relationships with others and our sleep to have a better life? And so by using the design thinking approaches, I think it makes us better decision makers. And it allows us to find new opportunities for really meaningful value in the world. So I hope you enjoy the time over these few days and also take these ideas forward and play with them in your careers and the different areas you're working, but also in your life. So thanks so much.
So fantastic to hear such a great illustration of the use of design thinking. So Elle, what's up next?
So next we are going to go to Snook. Snook are a design agency who design viable, sustainable and fair services with people's real needs at the heart. Design thinking and user experience are at the heart of everything that they do at Snook. It's really important to all of their staff, and their staff are experts at it. So right now we're going to head over to hear from Rowan Speer, who is a senior service designer, and Tash Wilcox, who's their head of learning. They're talking about a piece of work that they did with the NHS. Enjoy.
Welcome to Design Thinking with Snook. I am Tash Wilcox. I'm the head of learning design at Snook, and I'm just going to say, I'm going to point that way. He might not be that way. This is Rowan. Rowan, do you want to say hello?
Hi everyone, my name's Rowan Speer. I'm a senior service designer at Snook.
Brilliant. Thank you, Rowan. So Snook works with everyone from governments to charity to businesses, and we work predominantly in service design, user-centered design, but we're a full multidisciplinary studio. We only have 9 minutes. I could talk about Snook for a long time, but I'm not going to. What we're actually going to be talking about is design thinking. We're not going to go into what design thinking is. You've had a lot of people speak to you over the days. But what we want to land is a few learnings from our experience within Snook. So I'm going to start with a story that first came out from Desmond Tutu, but it's actually featured in the book Upstream by Dan Heath, which is a fantastic book. But what he was talking about was that there were two people stood at the side of a river, and they're having a little bit of a chat, and all of a sudden a child comes floating down the river, and one person just strides into that river, grabs that child, drags it out. 2 seconds later, another child comes floating down. The other person rushes in and grabs the child, and before you know it, every 2 seconds there's a child floating down. They're taking it in turns, grabbing these children, pulling them out of the water. And finally one of them just goes and stands back and starts walking away. And the first person goes, "What are you doing? Why are you walking away? There's children coming down the stream." And the second person looks at them and goes, "I'm going to go and find out who's chucking the kids in the river." So why have I told you this? In healthcare, it's a really, really difficult space. It's a lot going on, and Rowan's going to go into this a little bit deeper later. But it's really, really important to understand not to just concentrate on the children coming down the river, because that's not the problem. Solving that and putting all of your attention there is actually just putting a sticky plaster that's going to bleed through on sort of like a really vicious wound. What you need to do is go upstream. So look upstream, find the actual problem, find the root cause. Okay. So one of your biggest tools in doing this is curiosity, asking really good questions, active listening, and the word why. So the word why will probably keep coming up. So, like I said, why is this challenging? Why is this challenging in the NHS and healthcare predominantly? It's because of something called tunneling. So this is one example. There's lots of different examples out of there. And this comes from Amy Edmondson, and she talks a lot about psychological safety. But they actually looked into studies that showed nurses solved unexpected problems every 90 minutes on average. So that's amazing. They're professional problem solvers. However, there is a problem in this. Their creativity and efficiency, which are signs of a good nurse, masked the tracking of the problems. What they did was they created hacks, but they also created a system that never learns. And that's really, really important. A system that never learns. There's no feedback in there. There's no way of solving a problem if you're not aware of it. So problems including having to borrow towels from other departments or cover shortfall, and repeatedly having to find security tags required for newborns to be discharged. The nurses, as I said, were tunneling. They're focusing on short-term reactions to problems without the formal opportunity to feedback on these issues or the space to consider the potential preventative solutions. So like I said, if you're not aware of the problem, you're not aware of sort of like that intricacy, you can't solve it. So I've mentioned Desmond Tutu, I've mentioned Amy Edmondson. I'm going to pop another quote in here. Let's add in Einstein. So I really love this quote. I use this quote a lot. So Einstein said, "If I had an hour to solve a problem, I'd spend 55 minutes thinking about the problem and 5 minutes thinking about the solutions." So humans are a little bit solutions sort of they like those solutions. They like jumping to those solutions. So it's really, really important to understand what the actual problem is. Get to that root cause, ask people, understand what's behind that problem. So I'm going to pass over to Rowan, and he's going to dig a little bit deeper. Over to you, Rowan.
Thanks, Tash. I think that's a really good point to sort of segue into an example that I'm going to give when we've worked with NHS 111 and some previously overheard comments from one of our clients in the NHS, where they started sort of at the end and then were excited to sort of get us on board to do the bit with listening to patients. They said that they're really glad that we were on board in this project because they can now start figuring out how they can get patients to use the service that they designed. Now, hopefully, you know that that's sort of the wrong way around, and that design thinking and the user-centered design methods that should form part of that thinking should require us to consider users throughout the process, not just at the end. And speaking about this 111 project that we worked on, we were required to think about all those aspects when we worked alongside NHS E&I, which, as you may know, is NHS England and NHS Improvement, to look at the 111 service. And the 111 service has multiple providers run the service in different regions across the country. And those providers have different operating models that don't always work well together, meaning it can be difficult to manage call volumes and spread the load between various regions. The NHS had proposed a new operating model that they hoped would resolve some of these issues, but they hadn't done enough work to figure out what the existing problems were across the country, but also where there were aspects of certain operating systems that were working well and should be incorporated into a new system. They essentially tried to solve the problem quickly without doing the groundwork first, without doing that user research, without asking why, understanding the problem space. And various higher-ups within 111 had called them out on it. So our brief essentially as designers was to come in and engage with stakeholders from across 111, map the various operating models in play, and figure out where those opportunities and challenges were for a new operating model, so that NHS E&I could redesign their proposal from a sound user-centered design foundation. And one of the sort of reasons that design thinking in this space is particularly challenging is that NHS, as you guys almost certainly know, is currently in a near constant state of crisis. Time is in very short supply, money is in very short supply, and staff are extremely busy. Multiple times when I've been working on NHS projects, we have key participants for meetings, interviews, workshops, etc., cancel at very short notice. They've been pulled into something extremely urgent with a patient, and they've had to postpone or cancel entirely those engagement events. Things can take a very long time to organise and carry out within this space, and naturally, people look for shortcuts in the environment, in that environment, and inevitably you end up with that sort of tunnelling. So another quote that we're going to throw out at you this time from a person called Herbert Simon, is that everyone designs who devises courses of action aimed at changing existing situations into preferred ones. And what we're trying to say really is that we're not asking you to be designers, and we're not here to make you into designers. You are incredibly good at what you do yourselves. What we want you to do is to embrace your curiosity, ask questions, embrace that ability to find out what the actual problem is, be comfortable in those uncomfortable spaces, and be comfortable in ambiguity. We found that people who work in healthcare have learned a lot through using design thinking, essentially to measure twice and to cut once, understand what exactly it is what their problem space is before they start to develop solutions, so they can essentially make the services that they create more sustainable, the ability to sustain them in the long term. I'm referring to there. So if they can spare the time up front, they actually save time in the long run. And what they've created is a far better chance of working for people and far less chance of requiring constant redesign. Essentially, what we're trying to get you to take away from this conversation is that we want you to find the root cause, ask why all the time, identify the actual problem. We will end up with a beautiful solution that nobody needs. And a final quote, this time from Don Norman: design for how people behave, not how you wish they'd behave.
Thank you very much, Rowan. Thank you for listening, and enjoy the process. Dive in. Thank you very much.
What a really interesting conversation.
Yeah, absolutely. Okay, thanks everyone. Thank you for tuning in today and for engaging with the Future Me team on the YouTube chat. It's been really interesting to hear from you and answer your questions. We hope that this broadcast has helped to inspire, to add context, and hopefully will support your own work developing.
Tune in at the same time tomorrow as we move through the double diamond and reflect on asking good questions, understanding the user, and considering what happens when we get stuck. We'll see you then.
Bye. See you then.